My name is Tracey Punzone. I'm 51 years old. I live in Sarasota, Florida. And some of my hobbies are biking, walking, dancing, paddleboarding, and anything to do with my dogs. I love being with my dogs. So I started having high blood pressure in my mid-30s. I would go to my general doctor. He would follow up with, I think you should go on medicine, your family genetics, your family history. So that is when I started to go on blood pressure medicine. My blood pressure kept going up, and they just would increase the dosage, and I would just feel dizzy, lightheaded, just overall tired from the medication. So it was the beginning of 2022, January 10th to be exact. I ended up in the emergency room due to flank pain, lower left flank pain. I kept telling the doctors I have lower left flank pain. They did a CTA scan and they found a left renal aneurysm.
Tracey had a very complicated problem and a very complicated year. Her blood pressure had gone up to the point where it was uncontrollable and really severe high blood pressure that was threatening to cause a stroke. And she had severe flank pain, which is what took her to the emergency room on at least one occasion. And she was found to have two different problems. She had fibromuscular dysplasia, but she also had an aneurysm in her left kidney. And that was probably related to the fibromuscular dysplasia, or FMD, as we call it for short. So fibromuscular dysplasia, or FMD, is a disease of the arteries that occurs in women. And what happens is there's an abnormality in the wall of the artery that creates a narrowing. And it creates a peculiar type of narrowing, an appearance that we call a string of beads, that actually creates webs inside the artery that creates narrowings and reduces blood flow.
Once I was diagnosed, I was terrified. I thought it was a life sentence. I thought I was going to die. I thought I was a ticking time bomb. So getting through my days were difficult, and I'm grateful I have a supportive family and dogs. I had a lot of dog therapy.
The way we treat it is to actually use balloon angioplasty to disrupt those webs and the irregularities in the vessel. And once they're disrupted, the artery has the capability of actually healing itself, so that the recurrence after angioplasty is actually very low. As a result of the angioplasty we did, her fibromuscular dysplasia, or FMD, was greatly improved. And as a result, her blood pressure was greatly improved. And we subsequently know now that the pain that she was having also improved.
So my life today is wonderful. I feel amazing. Since December, I'm 3 months without blood pressure medication that I took for 15 years. I would highly recommend the Miami Cardiac and Vascular Institute for Care. I had excellent care from the moment I got there for my procedure until the moment I left. The staff, the crew, the team, everyone there helped me. What I would like to say to Dr. Katzen is thank you from the bottom of my heart. And I've said this to him before, you are my Superman. You helped me in a time where no one else could. You listened, you cared. You're a wise man with a gentle nature. I truly appreciate you, and I trust you with my life. Thank you for caring about me.